Muscular dystrophy. It's the second most common single gene disorder in Western countries. There are 434 different muscles in the human body, which in the adult contribute to over 40% of the total body weight. Muscular dystrophy has a category of 9 different types of muscular disorder. We have Duchenne muscular dystrophy, the most common, Becker muscular dystrophy, facioscapulohumeral muscular dystrophy, and myotonic dystrophy. Congenital muscular dystrophy begins at childbirth, and the symptoms are general muscle weakness, progresses slowly, and has a shortened lifespan. Duchenne muscular dystrophy is most common during childhood. Normally affects only boys. They start showing symptoms when they start walking. Around the age of 10, the child may need braces. Around the age of 12, they're not able to walk, and the lifespan is from 15 to 45 years. The gene on the X chromosome only affects males more than females because of the X chromosome. Because girls have 2 X chromosomes, their symptoms are less than boys because they have another X chromosome to rely on if one of them is defective. They have a dystrophin protein that helps the cell stabilize the sarcolemma in the cell, all the way to the extracellular matrix to keep the cell sturdy. Without the dystrophin in place, the sarcolemma has no support and it unstabilizes the cell. Over time, the proteins start escaping the damaged cell and calcium enters, and the cell then leads to cell death. Symptoms are the muscle changes in size, the child waddles when trying to stand, the calves get enlarged because of fat and fibrosis, and there is no more muscle. The hips are weak and the child uses the arms to stand. Having a weak upper legs is called goer sign. Later on, the child ends up on a wheelchair, and sometimes respiratory failure occurs. Having a weak diaphragm, or scoliosis, or dilated cardiomyopathy, or arrhythmias. Unfortunately, there is no cure for muscular dystrophy, so it is recommended for a child to start physical therapy at an early stage to get a better quality of life. So there are only a few medications used to treat and help with the symptoms for muscular dystrophy, and most of them are steroids to slow down the muscles' degenerations, and anticoagulants and immunosuppressants to delay damage for dying muscle cells. But sometimes these cause certain side effects. Some of them cause weight gain,